We've played nice, stayed quiet, and tried to fit into boxes we were never built for. But guess what? That version, she's done. Now we walk different. We talk different because we are different. We're not waiting to be discovered because we're busy discovering ourselves. Raising babies and businesses, healing, breaking cycles, and making moves that move us. This is what it looks like when we stop shrinking and start showing up.
As Black women, we are some born soldiers. Do you hear me? And so when it comes to your health care, don't you dare be quiet. No one knows your body like you.
Right.
Regardless of their professional training or whatever the case may be, you have a village. And your village may not have the same last name as you, and that's okay. Everybody wakes up every day with two things. I don't care how much money you got, how much you don't got, how sick you are, it doesn't matter. Everybody wakes up every day with two things, and that's a chance and a choice. We all go through stuff, and we all need somebody, bro. It's gonna be okay. It's gonna be good.
It is.
We definitely have to get out of the mind frame where I have to fight every battle by myself.
Ooh,
because
that's
no,
so
you don't.
good.
That's
No,
the
you
first thing.
don't. Yeah.
No, you do not.
Suffering in silence. Suffering
Yes.
alone, suffering in silence.
Silence.
Welcome again to another episode of Totally Unmuted. Y'all, today we have a very special guest, Miss Robin Bennett, the community builder, just helping us understand the access that we have when it comes to healthcare, just resources, just all the things. And I'm definitely glad to welcome you here. We're glad to welcome you here. Because, this is such a very important topic, and you work so close, when in the community when it comes to like healthcare and things like that. You've been doing it for such a long time.
Yes.
Family Road,
Yes.
Healthy Blue.
Yes.
Where were you before that?
So Family Road first, and then after that, I was with the Safety Place. Place, and then from the Safety Place, Healthy Blue.
Wow. So what has it been like working with all of those different community organizations?
It's been amazing,
Really?
actually, and I'm still very close to every single one of them. Because working for them, of course, I created or found a passion for what it was that they were doing, what their cause was. Of course, Family Road is a one-stop shop for young ladies that are expecting. And so I had no idea when I first went there. I was going for a job, and being able to work with young ladies who looked like me, talked like me, went through the same things as me, just gave me a whole new perspective on life and on who I was. I got pregnant at 17. And when back in the day, I know I'm very young looking, but
But when
I got pregnant, there wasn't a lot of resources, being a pregnant 17-year-old, it was shunned. So
I was just about to say that,
it was hard. It was hard. And so all these years later, I come to Family Road, and this is what they do. And because they wanted to cut down on the disparities of like low birth weight babies and things of that nature. And of course, to be able to do that, you have to be able to go in and serve those pregnant young ladies and giving them that information and those tools that are necessary.
Yeah.
And so I just kind of really sat back and was like, oh my God. Like, this is my why. This is my why, And so, and from there, it has created an 18-year career for me, community path. And so I tell people all the time, there are lots of things in life that I question. Who I am.
Right.
And what I'm supposed to be doing. Are not two of them.
Because when I think about healthcare, I don't just think about it like care. I think about it as community. It's connection. It's equity. It's access. So, to the women out there, especially Black women that are struggling with navigating our healthcare systems, that feel like they're not getting the healthcare they deserve, their voice is not being heard. You see so many disparities when it comes to Black maternal health and just all of these things. Sometimes our voices are quieted when we are in the hospital rooms, And so to the woman that may feel like that right now, like, what do you want her to get from this conversation today?
I want her to feel empowered to be able to advocate for herself.
That's good.
And if you are not getting, just like anything else that we fight for, let me tell you something. As Black women, we are some born soldiers. Do you hear me? And so when it comes to your health care, don't you dare be quiet.
Yeah.
I tell them literally all the time. As soon as you were born, the doctor did what? Hit you on your behind so you can open,
cry.
so you can open your mouth.
Open your mouth.
So you dare not get in front of a doctor and close it.
Yeah.
You understand what I'm saying? If you, I mean, there are so many out there, and everybody has to answer to somebody else. No one knows your body like you,
Right.
regardless of their professional training or whatever the case may be. So if you feel that something is wrong and that one particular professional is not hearing you, go to somebody else.
Yeah,
get a second, get a third, get a fourth opinion.
Okay. So what does that look like for the person who doesn't want to be labeled with having an attitude, or they're loud, or right, and so they feel like they may not have a community or a family to back them up,
Right.
Or they know how to articulate it.
right, or don't know how to articulate
Yeah.
what it is that is going on with them. What does that look like as far as like advocating for themselves? Like, what are the steps that they would need to take as far as like you saying, like getting a second opinion, a third opinion? Like, what does that look like?
Right. So definitely, if you feel like that you can't advocate for yourself, then definitely get in contact. And that's one thing that I love most, is being able to connect people with community organizations that do this. So allow somebody else to be able to do this for you. But you have to be strong enough to say, I need help. How do I help me with this? I'm having an issue, just say like with Family Road. So each young lady was assigned, I of course did community, but each young lady was assigned a case manager. And so each case manager, and that's what they did. If she was having an issue with a doctor or something like that, then that case manager stepped in or accompanied her and went to the doctor. Went to the doctor with her to kind of see what was going on.
Like an advocate, like a medical advocate.
Like a real advocate. And that's why community, when we say community is so important.
It is.
We definitely have to get out of the mind frame where I have to fight every battle by myself.
Ooh,
because
you
don't.
Good.
That's the first thing.
Yeah.
No, you do not.
Suffering in silence. Suffering alone, suffering in silence.
Yes,
Yeah.
you do not. And especially when it comes to our medical care. Like, especially because even with me, I can remember, my doctor saying I was 17. And so my aunt, my doctor decided to go ahead, and I was only like maybe going in a couple of weeks early, and my doctor decided to do a cesarean section. But I remember my auntie being upset because she didn't agree with that. You know what I'm saying? The longer the baby stays in, the healthier the babies are. Yeah.
So was it a schedule? Did he want to, like, did they ask you how you feel, or did he explain
She was
to you?
17 also.
No, but but it still doesn't matter, because again, this is the type of stuff that happens.
Right, and exactly. And at
Did they ask
17,
you?
I'm feeling like you the doctor.
Right.
So you know what's best. You see
And
what
a
I'm
lot
saying?
of times in our community, we do feel like that about bankers. We
Everything. Because you're the professional. You're the professional. But if you feel in your gut that something isn't wrong, then you are the professional over your body. You are the professional.
Exactly.
Day in, day out, lights on, lights off. You okay? It's you and that body, babe. And so feeling like no matter what, that somebody else, knows it better, because no, that's not always the case. It's not always the case. So yes, definitely. So when it comes to advocating for yourself, if you feel that you can't, then reach out, get in contact with an agency that does this. If the Family Roads, the Bridge Agency is an amazing organization. Families Helping Families. Like, there are so many community organizations that are out there, and that's what they do, is advocate on behalf of their clients. So if you feel you can't do it for yourself, get in contact with the agent. That's fine. We have to get out of that norm that it means that something's wrong with me if I go and ask for help.
I look stupid.
Right.
Yeah.
That sort of a thing. No, you're not.
Yeah.
So what would you say is some red flags to be indicators to be like, okay, I think I might need to get a second opinion or talk to my caseworker so that they can advocate for me? Like, what would be the red flags that you would see with a medical professional to seek help?
So if you feel like you can't talk to your medical professional or your professional, you know that you're feeling a certain way with your body. And they keep telling you time after time, oh, nothing's wrong, or that's normal, and you know that you feel that something is definitely wrong, then go and get a second opinion. And if you feel that you can't, then yes, go ahead and get somebody else to advocate for you, because we've seen that time and time again where women were, even had pulled up to the hospital to, thinking that they were in delivery and was sent home and then had to be rushed. It's all sorts of
that
things.
happened with Soraya.
Right. And I tell people,
that's what
baby,
happened with her.
okay, if that's how they feel, leave that hospital and go to another one.
Yeah.
Go find another one. That sort of a thing. Get on the horn. We on Facebook for everything else. Look, I need a nurse. Can one of my sisters, somebody call? Yes.
Hey, I need a nurse.
Yes. Hello. Because that's how we took care. That's how our ancestors did it. And
it was really a village.
It was a village. Yes.
Yeah.
And that's what I love doing, is just simply connecting people to the resources that are needed, And I tell people all the time, especially like when I worked for Healthy Blue, look, we told the state that we was going to do this, and this for you, not hold us to it.
Yeah.
And I mean that. You understand what I'm saying? I want us to be our best selves. And we can't do that, if we're not taking care of ourselves holistically.
Right.
That's mind, body, spirit, emotions, all of that. You know what I'm saying? We get this one life. And I want us to live it tremendously. Do you hear me?
Yeah.
Somebody asked me the other day, they said, well, actually, it was my godson. And he's 8 going on 68. And he came to my house, and my Christmas tree was lit up. This was 2 weeks ago.
Yeah.
And he was saying, Nanny, he said, why you still got your Christmas tree on? And I said, because I love it.
Yeah.
So why would I wait a whole nother year?
Yeah.
To put it back on?
Yeah.
Do you hear me?
Right.
Yeah.
Right. Normalizing
doing what makes you feel happy.
Right.
Yes.
And right now.
Yeah.
And so we have to become okay with taking care of ourselves, our bodies. And girl, so sitting in some of those meetings, I'm like, wait a minute. These people in our Black and brown communities, like, we really are suffering. And most of the times, don't even know we suffering.
Don't even know. That's
you know what I'm saying?
Seriously.
Like, we're suffering and don't even know we're suffering.
Proximity matters. And if you're not in a situation to where the information is readily accessible to you, you're not gonna know. Or if that is your normal. Because sometimes what is normal for you is just your normal. That's all you've ever saw. So you don't know that it's abnormal. You know what I'm saying?
That is it, and that's all.
That is
definitely
super amazing.
I advocate. It was so crazy because I was at an event on just yesterday, and I advocate for so many companies and for so many organizations till, like, literally someone walked up to me and said, Robin, well, who are you representing today? And that felt good.
Right.
Yeah.
It depends what you need. Because I got you. What's the, what's
up?
Yeah. I make it, I have coined myself the community connect, because we need to know.
Girl, I say, look, on here, I say community build.
Yes, like the community connect, honey.
Yeah.
Because baby, we writing, we fighting for grants and all of that. So when you get it, I need you to be putting that money in the community like you said you were going to.
So what is it like working for big organizations like that, even like an organization like Healthy Blue? Like, what does the intricate pieces actually look like for the help that Black and brown communities actually receive?
Actually, and I can't, of course, speak on the other Medicaid plans, but I know when I worked at Healthy Blue, it was amazing because it was a lot of us that was making the decisions for us. And representation matters.
It does.
It does.
Representation matters. I tell people all the time that it's not just a slogan that belongs on a t-shirt. Representation truly does matter. When I walk in any space, I'm going to automatically, regardless, feel that there is a connection between us, because nobody knows how to Black woman like a Black woman.
Right.
Do you understand? You're going to know my plight. You're going to know my struggles, regardless of, you know what I'm saying, our own personal roads travel. There's still some things that we share. There's you know what I mean? So yeah, representation matters. And it was a lot of, and so once the research was done that, okay, so out of all the, these are the communities that have the highest number of.
So the research was actually done in certain communities.
Yes.
What kind of research was it that was being done?
They were finding out that, of course, like, we were dying faster than our counterparts. We had more high blood pressure, obesity, things of that nature.
What about mental health? Was that
one?
Oh, yes.
It's definitely one. Mental health was definitely a huge component. And so I was very glad to see literally especially a lot of companies start to put mental health at the forefront of, you know, their services that were offered. So like, yeah, free mental health. Like,
Yeah,
and that's
that's
so
what I'm saying,
important.
yeah.
Yeah, most definitely.
So are there programs out there now where people who are like, I cannot afford a therapist, I cannot afford a psychiatrist, there
Yeah.
are free services that
Yes.
are available too?
Yes, especially, and then make them, if they have insurance, of course, check with your insurance and see what's available. If you don't have insurance, then you can always apply for Medicaid. We have 6 Medicaid plans in the state, and all 6 pay for mental health. And if you just get on the
Really?
Medicaid just to pay for your mental health, do it. You understand what I'm saying?
Wow.
Yes. Beyonce
Wow.
has a whole squad behind her to make as good as she looks on stage.
Right.
Yeah.
And we need our whole squad. I got
Right.
my mental health, my therapist, my my counselor, my coach.
Yeah.
Yes.
Right,
Yes,
right.
exactly.
Yeah.
And it's okay.
Right.
I love that about me. You know
Yeah.
what? I did something silly the other day and I said, you know what? That's some robbing of me. But I love it.
Yeah. Yeah.
You know what I'm saying?
Embracing the
Yeah.
full you.
Embracing all of that. Girl, I don't have
Yeah.
time to worry about my shortcomings.
Yeah, that's so good. That's so good because I think that we do a lot of times focus on that.
We internalize so
we do.
much. We
and we
do.
let it become like who we are. But
Right.
I think that you definitely, again, going back to like the village, you definitely have to have the village, and proximity matters. And the ladies that were just on, that's what they were talking about, just doing a self audit.
Yeah.
Looking around, like who's in your circle,
Yes.
like who's pouring into you, who's taking out, you
Yeah.
know, taking from
Definitely.
you. You know, it matters because you can't give from an empty cup.
Right.
You know, and then everyone needs something. Everyone is gonna pull from someone. You know, you're important to someone just like I'm important to someone.
Right.
You're important to someone just like I am. So I think that's super, super, super important.
Right.
But when it comes to this, what do you think is like one of the biggest barriers for us when it comes to like healthcare? Do you think it's like the money? Do you think it's a lack of insurance? Because me being in the insurance world, I have been able
Yeah.
to see that we do lack adequate healthcare insurance.
Yeah.
Sometimes we don't even feel like it's important.
Right. We don't.
Yeah.
We don't.
Yeah. So
Yeah, and coming out of certain communities, and I'm going to say this, and I'm going to be totally honest and transparent about it. We live in a very tangible society. So, you know, if I'm worried about how I'm going to pay a bill, I'm worried about where's my boo, and I'm worried about, you understand what I'm saying? Then my health
it's the
It's
last
taking a
is the
back
last
burner.
thing on my
It's
mind
a back
until
burner.
something happens.
until something happens. Honestly.
Yeah.
So
Because the resources, I mean, honestly, are out there now. At one point in time, you had Medicaid and it barely paid for you to see a doctor.
Yeah,
and
that's
I'm
true.
going Medicaid. I'm not even talking about like private pay right now. Nowadays, Medicaid covers the gambit, covers everything. They even have housing, like, you know, certain programs, certain ones have, like, if you're, you know, going through an issue and you need, you know what I'm
That's
saying?
true.
You need that help, you can call your Medicaid for that.
Yeah.
Like, you could call your Medicaid and get a car seat. You could
Yeah.
call your Medicaid plan. Yes.
Yeah,
So,
that's true. I was able to see that
Yes.
with working in the Medicare field. I was able to see how much the people that are on Medicaid and Medicare, they get the works.
yeah.
Yeah,
And so,
they do.
and I tell them, take advantage of
Yeah.
every single bit of it. Like,
Yeah.
take advantage of it.
Do you think it's a lack of knowledge?
Yes.
Okay, because I'm like
Mm-hmm.
you're saying all these things are available. I don't know because it's been I haven't been around anybody that has been pregnant other than my kids.
Uh-huh.
Even for my own daughter that just had a baby, I don't think she knew the full scope of what was available
Mm-hmm.
to her. So is it something that you think that Medicaid should focus on, like giving like a packet or something like that to like let a person know all of the
Yeah,
services
and
that are
Medicaid
available?
Normally, if Medicaid doesn't do it, then like normally, like young moms, like when they go to WIC services or like WIC
Oh,
services,
yeah. They'll have
do
pamphlets
it.
and stuff like that.
But I think it's just a matter of us seeking those types of things, depending on what it is that you're going through or what you need at that moment. You know what I'm saying? But yeah, it's definitely a lack of knowledge. Some people, they just don't know. You know what I'm saying? So people ask me that all the time. And again, that's another reason I coined myself the Community Connect, because yes, we have agencies that cover this. What it is that you need. I know somebody who's doing something, whether you're trying to go back to school, whether you're trying to get a job, and like places like Family Road does everything. You can go there and get prenatal services and, you know, A TWIC card.
A car. I got my first car through Family Road.
I didn't
Like,
even know Family Road was
seriously.
still,
Yeah.
I didn't know that they were still
Yeah.
open, but I mean, of
Yes.
course, I mean,
Yeah.
I'm not around that many.
Yeah, so I started
Housing programs?
Yes,
Well, it
I
used
started.
to.
Yeah, I started in Family Road in 2007. So that's where I started this work at, and was there for 9 years. And I now sit on their board, executive board of directors. So they are definitely open, and we're definitely moving. And yeah, and it's just trying to get people to understand that these resources are available to you. You have a village. You have a village, and your village may not have the same last name as you, and that's okay.
Yeah, that's good.
Look for your village. It's
Yeah.
okay. It's fine.
So what are some of the initiatives that, you know, are being pushed now with some of the organizations that you do have relationships with, just in all areas of what we actually need when it comes to healthcare, when it comes to, like I say, mental health, when it comes to pregnancy, when it comes to just access housing, like I know
Right.
some, because I know Family Road did do that. Like that was literally how
Yeah.
I was able to purchase my first car. So a person probably wouldn't even think about going to Family Road for a
Right.
program like that, but that is how I purchased my
Right.
car. So like, what do you think? What do you see as some of those initiatives with some of those organizations that
Right.
that are being pushed right now?
So definitely, Family Road, and Family
Road is good. Yeah,
They are just a
yeah.
bomb. Like, and I'm not saying that because I'm a
Advocate
No.
for them.
but
It's giving you really
yeah,
believe in
yeah.
Yes,
you saw it.
and that's it, honestly. But just like Family Road, okay, then there's a safety place. You can go to the safety.
What's the safety place?
Okay,
I've never heard
so
of the safety place.
was originally Lexley's Kids, and they did car seat safety. They did car seat safety and
wow.
teen driver safety. So you could
Wow.
actually go through the safety place, and they are certified car seat installers. You can go there, get a free car seat, because of course everyone needs a car
Whoa.
seat before they leave the hospital. And now you can also take a safety class, girl. You can get a free baby bed, a free this and
What?
that. Yeah, they have a new teen program where they're teaching teens how to be like professional babysitters and training them with CPR and all sorts of things. But you just have, it's there.
That is
You have to look for it though.
amazing.
That's
And what's the name of it again?
But
That's
but see,
the
that's
safety
thing.
place.
Why
The safety place.
do?
Yes.
But
Shout out to Krista Pichon, the CEO. She's amazing.
But why do people have to go look for it? That's one of the things too, that it's like if it's really accessible, why do we have to go look for it?
Because it's, what do you mean by accessible?
I'm saying accessible meaning that it's tangible. I can actually go there.
Yes.
You know, you get what I'm saying? I can actually go there. I can actually get involved in this program. But if I go to Google, I need a car seat. Am I going to be able to find it, find the address, be able to call, maybe talk to someone? You kind of see what I'm saying? In that way, because sometimes with some of these programs or some of these nonprofit organizations that say they do certain things, you go to their website, you call, you leave messages. I'm just saying, even when me being a teen mom, they wouldn't answer the phone.
Right.
You know, or they never called you back. So if it is so accessible, then why do we have to go look so hard for it?
Because that's the lay of the land.
And that's
Let's-
why I was
I
like,
like
I
that.
mean,
I mean,
but I was like, this way, you give like a little booklet. And
Right,
say, hey,
and they
yeah.
have them, but you know, things change, and most of
Yeah.
these nonprofits work off of grants.
Yeah, that's true.
I mean, and so it just depends on what's going on in the world at that time. So just like right now with, you know, DEI and federal funds being cut, so you might have programs that were here yesterday
And gone tomorrow.
And
are gone tomorrow.
Yeah, that's true.
Yeah, so you just have to be on your A game. But when it comes to doing for you though, it shouldn't be no lax. I'm gonna keep looking and digging and searching. It just is what it is.
I'm
You understand
telling
what I'm
you,
saying?
That is so true, Robin. I just from me going to like, and I didn't, you know, another thing too, I was thinking about, you can't be prideful.
No.
You cannot be prideful, because I'll never forget when I got that call. Like, and this is another thing too. Some of the programs you have to plug into the program.
Yeah.
They're not just gonna give you the money. I had to go to classes.
Yeah.
I had to be taught about credit. I learned, like, Family Road literally taught me about credit. They taught me about the loan that they were giving me to pay for the car, and I ended up paying the car off in maybe like 10 months or something like that. I got me a Sebring, baby, with all black interior,
Come
black
on now.
leather seats.
Didn't they make a commercial?
Yes, I really did.
Did you have the drop top?
Sebring,
Girl.
no, it was a Sebring RS, but I had a sunroof.
Oh, well,
Yes, I'm telling you, a real talk. Like
Right.
then I started going through their housing program. But like I say, this was years and years and years ago, you know. But I started going through their housing program. The only difference with the housing program was that you could not be married.
Mm-hmm.
That was the thing. You couldn't be married, and if you were going through a divorce, because at the time, me and you know, we were separated. But I was dumb, and I'm saying dumb because I was. And then we got back together, which we shouldn't have. And then I lost the opportunity to get the house. But they actually bought you, like, had a program where you went to the classes. They taught you about getting the house. I had already gotten a loan for the car. So I got into this program. And, of course, I would have been able to get the house. But just being young and dumb, you know. So, and that was just me going there. And I don't even know if I was Googling, but whatever it was, I poured into. I had a case manager. I had a really, really good case manager. And whatever I was talking to her about, you know, just explaining to her, she was the one that told me about all of the other programs. So you do kind of have to advocate for yourself. It works. And this was years ago.
Yeah.
You know, this was at least 10 plus years ago.
Yeah, you definitely have to. And I understand that. And I do believe in meeting people where they are. So, you know, I am big on trying to plan a huge community event with all the perks and, you know, let's get the food, let's get the music, let's get a good time. And so, and let's make this feel good about getting this information, because you should, you know, you absolutely should. But sometimes it's just still that, you know, it's sometimes, and we all understand, like, there's still that disconnect.
Right.
Yeah.
You know, there's still going to be that disconnect. But, you know, the Community Connect, try as hard as possible to connect those that need resources with what they need.
So how often do you give, like, those community events where?
Girl, year round. All the time. I'm already planning. The babies just got out of school the other day, and we are already planning back to school events.
Really, we definitely want to. We definitely want to, you know, volunteer, but then also like donate. Like seriously, whatever you guys have coming up, like make sure you let us know so that we can donate. But I do want to ask you this too, like what are some successes that you've been able to see? Maybe that's like personally with someone that you actually work with, or just through some of the organizations. Like what have some of those been?
To date. And this is a story that is near and dear to me and very personal. And it goes back to Family Road and why I really delved
Family Road, you the truth.
delved into this work. I can remember them having a retreat for the young ladies in the program, and they asked me to speak. And I said, okay, but I was an employee, so you want me to speak on behalf of Family Road, or you want Robin to speak?
Yeah.
You know, and they said, no, they need to hear from Robin. And so, you know, I spoke, and there were some things that came out in this room full of strangers that I had not even shared with my family yet. And so once I got finished, and I remember I went into the bathroom, and I was washing my hands and getting myself together, and one of the young ladies came in, and she said, Miss Robin, I never would have knew you went through all of that. And I said, well, yes, ma'am, I did. And she said, And so she just begun to tell me her story. And so when she left, I started to cry. And I could hear the Spirit saying, all the time that you was asking why me, that's why. She was able to see, well, if Miss Robin did it, then I can do it.
Yeah.
You understand? And for me, that is a measure. There is no better measure of success of knowing that I've mentored and I've coached babies to do and accomplish things that I never have. That is important to me. You know, we all go through seasons. You never know You could train for life all you want, but life,
Yeah.
my best friend always say, life gon' life.
And
Yeah.
it is.
Okay, and it's
Yeah.
gonna life. And so for you to be prepared or be able to help somebody get through this season up to the next, because that's my thing, even with all these resources, I want you to get so good in what you are, so powerful where you don't even need a resource.
That's
when
good.
you are the resource.
Right.
Yeah, that's good.
That's
Speak
my
on
ultimate
that.
goal.
Yeah.
Because you just
Yeah.
never know. You know what I'm
Yeah.
saying? People could take away a program here today, tomorrow. I'm not about to start.
Yeah.
Regardless, you could take it if you want.
Right.
And so for me, that is it. And every time I'm able to do that and to pour into somebody else or into the community, then I'm fed.
Yeah.
My soul heals just a little bit each
Yeah.
time. And so that's why I continue to do what I do 7 days a week. Somebody asked me the other day, well, Robin, what do you do when you're off the clock? Community stuff.
Yeah.
They said, no, when you're off.
Community.
Stuff.
Yeah. Yeah.
That's what
do you
I
feel like that's where your passion?
Oh my
Yeah.
God, most definitely.
Yeah.
Most definitely. It is nothing like it. It is nothing. I am okay. I can't do hair. I can't do makeup. I don't even want to.
Yeah.
Can't and don't want to. Community, I could do that with my eyes closed.
So what does that mean to you?
Community to me is taking care of the people who take care of me. And when I say take care of me, not that they do anything for me seeing them being able to get fed or, you know what I'm saying, get it to a better place heals me. It helps me. You can't put no price on it.
Yeah.
You understand what I'm saying? You can't put no price on it. All hell could be blowing. And for me to get a text or a call, matter of fact, I had a text message from a young lady I saw. I ran into it. And so we exchanged numbers. And so she texted me that night. I was laying in bed and she said, Miss Robin, she said, it was so good to see you. And I said, hey, sweetie, I said, I know. I said, we forgot to take a pic.
Yeah.
And she said, yeah. She said, but all this time, I just wanted to thank you for leading me when I was a young mom.
Oh, wow.
And she's like doing her thing now. You know what I'm
Yeah.
saying? And, you know, she was a young mom, came through Family Road, but she's now, you know, a graduate of the Southern University. And she's like, she's doing her big one.
Yeah.
And so to think like, girl, I was a mess when I was a young mama, but I was able to turn around and help you be a good one.
Right.
That's good.
Right.
That
so there's
helped me.
so
Yeah.
there's community for you. That's important
I
because
know.
community. A lot of people say community, but it don't be giving community.
Right.
But you are really giving community.
Yeah.
So would you
and
say?
she really be in the community. She really did.
No, I mean
yeah.
it's giving community. Because I see the light in her face
I
when
know,
she even
right?
talks about it.
Yeah.
So when you were at Family Roads and you saw like the disconnect in the girls that needed help, the young black moms, the young teens, would you say is that what fueled your passion in the beginning?
Most definitely. Most definitely. Because let me tell you something. We all go through something. We all go through something. And if we don't deal with it, it's going to deal with us. And oftentimes, that ain't going to be good.
Yeah.
So if I can say, regardless, like, let's go ahead and prepare for life. Because life on life. But regardless, you are not what happened to you. You are not, you understand what I'm saying?
Right.
You are not the mistake you made. You are not any of that. Because somebody had to do that for me.
Yeah.
I made a post one day because, of course, you know, all the high schools do their big alumni picnics. And so I went to Glen Oaks High School and I hated it. Sorry, Glen Oaks. But, girl, I was troubled. I had stuff going on in my head. It was just a lot. But it was one of my teachers who looked at me and was like, oh, my God. She said, Robin, you know, you just don't know it. She said, I've been watching you. And just something about you, something about your spirit. And I'm looking like, you understand? Honestly, you understand what I'm saying?
Right.
And so she just kept on. And I said, you know, okay. And although I didn't even let her in the moment know that I was listening, I was. So, of course, I went on to do some of anything.
Yeah.
I was like Boosie, touching down the calls. Hell, do you hear me? In my Boosie voice. But in the back of my mind, I would
still
always
thought,
hear her say, you're better than this.
Yeah, that's
You're going to
good.
do this and you're going to do that. So move 20 years later, I'm up speaking at a women's conference in Zachary. And so they announced me and was like, y'all, get ready, sit back. This speaker that's coming up, she's a little firecracker, blah, blah, blah. And I step up and I'm like, I don't know who that goodness is they was talking about, but you got me anyway. And so church starts laughing, but I hear someone crying. And I look into the audience and it was her.
Really?
And she said, I told you.
Wow.
Do you understand? So I am, and it's y'all, we all go through stuff. And we all need somebody, bro. It's going to be okay. It's going to be good. You understand, tomorrow, we wake up every day with two things. I don't care how much money you got, how much you don't got, how sick you are, it doesn't matter. Everybody wakes up every day with two things. And that's a chance and a choice.
That's good.
Every single day.
That's
a
good.
chance and a choice, honey.
Yeah, that's good.
And what we do with them, it's up to us.
Yeah.
You understand what I'm saying?
Yeah.
So trouble gonna come.
But it don't last always.
Right, and it don't last always. But then that's why you also too have to be, when I look at the minks of the world, and I ain't but one her though, but you understand what I'm saying? That's why, and it's, oh my God, I got chills just now. But that's why it's so powerful who you surround yourself with. Because I know when even me, you know what I'm saying, as much as I like to go, there are some times when, I've given so much to now I'm empty. And so I'm sitting here looking stupid, looking wise and otherwise, and I don't want to go no more. Then I see Mink saying, girl, baby, women, we have to do this, we have to do that. And you know what, Mink, you're right. Okay, you know what I'm saying? That's why it's so important to be surrounded by people who push you, you know what I'm saying? To push you to do better. And with your village, you have to know, and then you have to know what you could get from people.
Yeah. Okay.
Sometimes we, you know what I'm saying, disappoint our own selves because we be looking for people to give us something they ain't got.
Right.
That's like what the old people used to say. Remember, they used to say, baby, you sure can't get blood from a turnip.
Right.
Remember that?
That's true.
And so you be like, but honestly, if you cut a turnip, ain't no blood in there. Right. So it's not even that the turnip that won't give you the blood.
Right.
It ain't got you. So quit looking it from other people. You understand what I'm saying? So
who will be your? It's time for us to. Well, not time for us. It's time for you to shoot your shot. Because I'm gonna shoot my shot at another day. Not at no man though, but it's time to shoot your shot. So who will be the perfect organization, medical organization, or even like nonprofit organization that you would want to work with?
Yeah. And if they were watching right now, give you 30-second elevator pitch.
Well, you already know. I mean, I'm gonna just come off the dome, and my fave 5, of course, the Safety Place, the Bridge Agency, Family Road of Greater Baton Rouge, Families Helping Families, the Butterfly Society, which I'm a proud Butterfly Society, which was started by started by Councilwoman Tawana Harris. Yes, and the Butterfly Society is an organization for people that have gone through or have loved ones that have gone through domestic violence. And as you know, in the city, within the last week, we've already had 2 domestic violence deaths within 1 week. And so the Butterfly Society steps in, helps the family, help funeral cause, or we and victims that are going through it. Like, we help victims because you have to, people always say, well, why you don't just leave? Because it's not that easy, my love. It's not that easy.
It's so hard to it's so hard to leave your abuser.
That sort of a thing. And normally that's when you see the killings happen, is when that person has tried to leave. So you have to do it safely. Like, there's protocol, there's this, there's that we try to do. So definitely the Butterfly Society. How many are there? Butterfly Society,
that
Bridge. That's 5? Oh, okay. Because I can keep going, because those are those that have been proven in the community for years. And that's why, I'm always shout them out. And every time I pass the board on I-10 with the lottery, I say, Lord, if I win this lottery, I'm going to give Tawana $100.
Hey, Tawana, girl.
Yes, I said I'm going to get Crystal P. Sean $1 million.
Yeah.
She's going to buy all the car seats. Yeah, I'm going to get Family Road $1 million. And then I be forgetting to go buy a ticket. So, but nevertheless, I got y'all, boo.
Well, thank you so much, Robin, for being on. We really appreciate it.
Very informative.
Yes,
it gave community. It was giving community.
It definitely gave community.
Thank you.
We thank you so much, and thank you guys for tuning in to another episode of Totally Unmuted. Keep loving, keep laughing, and keep leaping.
Yes.
I said leaping.